So when you think about the term posterior pelvic tilt, what do you think about? A lot of times we think about someone that has an increase in their thoracic kyphosis, right? And some of us really think about a difficult motion in the physical therapy world that is hard to teach, right? That's that motion, right? Getting our patient or client to posterior pelvic tuck that is usually unfamiliar and awkward, and just they usually have a general sense of loss of ability to do it. That's what typically happens when we think about a posterior pelvic tilt. But in this video, I want you to start to change that meaning. And I want posterior pelvic tilt to turn into more of a sacral counternutation. Because I'm thinking as I say that, there usually aren't things that are triggered, motions, movements, educational pieces that are triggered when I say a sacral counternutation. But when you can start to understand what movements come with that and how sacral counternutation or a posterior pelvic tilt really impacts movement, that's how you can level up your comprehension of movement and get better results with your patients and clients. Sacral counternutation. What is it and why do we need to know it? Well, a sacral counternutation is usually correlated with a posterior pelvic tilt. And it's really powerful to understand the motions and movements that occur with this, so that way we can provide better exercises for our patients and clients and get them out of pain quicker. So sacral counternutation is when the sacrum tips in the posterior direction. And we have relative motions at the innominate bones that occur in relation to the sacrum. And those relative motions are flexion, abduction, and external rotation. So let's start with flexion. As the sacrum goes in the posterior direction, the innominate bone relative to that is going in an anterior direction. This is partially where we get our flexion from. So posterior of the sacrum, anterior of the innominate bone. Now for our external rotation and abduction, if we turn this around, what you'll see is that this posterior direction really jams up this space. And what's really going to happen is it's going to create a ripple effect of opening. And this is where we get our external rotation and abduction of the innominate bones. So now we understand the motions that occur at the sacrum and the innominate bones. But now let's differentiate it and start to understand it as it relates to a more practical meaning to movement. And that really is putting it in terms of compression versus expansion. So the body is always experiencing some form of compression somewhere, and usually on the opposite side, they're experiencing expansion. As it relates to our sacral counternutation, we have more compression posteriorly and expansion anteriorly. And you can really see that if it goes through its full motions, you can see how it's going to compress back here and really open up in the front. Now, the other way you can think of that is a locked versus an unlocked door. If you're trying to get out of a house that has two doors, one's locked and one's unlocked, you're going to move towards and then eventually move through the door that is unlocked, right? Well, that's how the body moves. It's searching for an area where there's expansion. And where there's expansion or an unlocked door, it's going to move through it. So we already said compression and expansion. Well, what does that set the human body up to really move well through? It's a vertical trajectory, aka squatting and lunging. So someone that usually has a posterior pelvic tilt is usually going to be better at squatting and lunging. But again, don't stop there. Understand the why. Well, it makes sense. There's a locked door back here. And to get into a horizontal trajectory like a hinge or a deadlift, it really requires you to move back. But if you have a locked door, as they try to move back, you can't go through that locked door, so you just go straight down and slide down the locked door. That's what's really creating this vertical trajectory. The locked door here allows nice and vertical movement. So the next time you are coaching or assessing someone that is biased towards more of a posterior pelvic tilt, I want you to start thinking about the motions that are occurring with a sacral counternutation position. And then I want you to understand that that person in front of you most likely will be better at vertical motions. We, as the clinician or the strength coach or the personal trainer, now want to really help them improve their movement variability by shifting them towards their other side of movement.